Now we're about to have another online presenter. So we are perfect on timing, and we are about to have our next speaker, Maksym Zhuravsky, joining us online. So if you have any questions, you will have a chance to ask them. You may also ask your questions in the chat if you join us online, and then I will read out your questions to Maksym. And now, Maksym, please, the floor is yours. You can start. Hello, everyone. I hope you can hear me well. Yes, I hope so. So my name is Maksym Zhuravsky. I'm psychologist, sexologist, the president of International Sexual Education Psychologists and Practitioners. And the topic of my speech today is wounded sexuality among civilians and military. This topic is very deep, similar to all other topics discussed during today's conference, and I will try to cover all basic aspects because my topic is about sexuality of both civilians and military, and I hope the information you will receive today will be helpful for you and you will have a basic understanding as professionals and as helping professionals, as helping supporting civilians and militaries related to ongoing war in Ukraine. So let's move on with our lecture. The first topic I would like to discuss is sexual abuse and trauma. I think you've all heard a lot, many terrible stories, terrible cases happening to people affected by sexual violence and abuse in non-government controlled territories, in liberated territories. And this is one of the most common issues for sexologists during the war in Ukraine. And so let us recall what the sexual violence is. Sexual violence is any actions, any unwanted sexual actions or attempt of such actions, coercion to sexual activities using violence, threats, or manipulations. Most likely, we include here physical assaults and psychological coercion and exploitation. And the next important point we need to understand is that sexual abuse has no limitation of statute. So after the war ends with our victory, we will continue to face these issues related to sexual abuse both among civilians and among military, because unfortunately military personnel may also be affected by sexual abuse, especially in captivity. They may be affected to torture, including to sexualized torture. It's a very sensitive and very difficult topic. So we need to understand the impact of sexual violence and abuse on mental health, how sexual violence may result in long-term mental health trauma, and people affected by sexual violence survivor often develop post-traumatic stress disorder, PTSD. I think today during this conference you have had the chance to listen to learn a lot about PTSD, about its impact, and maybe for someone is going to be new information. But sexual violence often results in PTSD because it's highly traumatic events, and people often experience flashbacks related to the sexual violence. It's also may result in depression, anxiety, low self-esteem, trust issues, intimacy issues, and so another issue sexual violence survivors are always facing is how to restore sexual intimacy with their partners. Here it's important to talk about it because unfortunately sexual violence may happen not just amidst hostilities by enemy troops, but unfortunately it may happen by people from close environments by spouse, but today let's focus on wartime related aspects. So here it's very important to use so-called trauma-informed approach to sexual violence trauma treatment. Unfortunately, trauma-informed approach is not that popular to sexual violence is not that popular in Ukraine. We often face a problem when a person comes to us professional in a very poor condition, which requires psychiatric interventions, and so it's really important to identify these cases because sometimes psychotherapy may not be enough to address certain issues, and so pharmacological therapy is needed, and pharmacological therapy is the responsibility of the psychiatrist. If we, for example, take a look at the British UK model, they use trauma-informed approach according to which if you are a specialized trauma therapist specializing in sexual violence, if you know well clinical diagnostic criteria, you are a clinical psychologist, and you notice severe PTSD or depression symptoms at early stage, then professionals try to work with it using their own guidelines without pharmacological intervention. Unfortunately, here in Ukraine, sexual violence survivors are often are often considered sick and prescribed with antidepressants. So it's very important to demarcate these stages, and we can do it only if we implement more trauma-informed approach and use United Kingdom protocols. Actually, United States of America also uses very popular strategy, and so if we notice that trauma therapy is not effective, then in order not to harm our client, we need to refer them to psychiatric assessment and pharmacological treatment. It's just very briefly about different perspectives related to this topic. And actually, because these people with sexual violence survivors are often considered sick in Ukraine, they may delay a visit to a psychologist for many years, 5 years, 10 years. It's strongly dependent on the society and social and cultural aspects, on the stigma surrounding the topic of sexual violence itself. For example, when we talk about stereotypes related to sexual violence, it's often about victim blaming. A person wearing a short dress may be exposed to sexual violence. So it's really important to work on to educate people on this topic, and unfortunately now during wartime we don't have enough of this education and we have a lot of work to do. Now let's briefly define sexual health. So what does the sexual health include? Sexual health, first of all, includes physical, emotional, psychological, and social component. It's a physical, emotional, psychological, and social well-being in terms of sexuality. It includes safe relationships when we talk about safe sex, protected sex, about consent culture, and so it's access to proper sexual education, rights to sexual autonomy and respect, and an opportunity to get medical care and psychological support. Actually, science about sexual health, it may sound strange actually, but over the last 3 years of full-scale invasion has developed significantly in Ukraine. It hasn't yet reached the proper level of development, but still the first steps in this direction are being taken and are proven efficient. Let me tell you from my personal experience. I'm a civilian and military psychologist and sexologist, and sometimes military personnel military servicemen come to me while they are on rotation or on rehabilitation during injury. So they come to me and to my colleagues with requests related to sexual health and sexual well-being. And the most common complaint among military is erectile dysfunction, erectile issues. The next thing is restoration of intimate life because when a person is in active combat zone, it affects different domains of their life. And the situation of war we all found ourselves in now shows that many different people are affected in different ways. Some may develop only PTSD, only mental health conditions. For example, PTSD caused by multiple losses of comrades, while other person, in addition to PTSD, because of these losses and traumatic incidents, may also develop sexual health issues such as erectile dysfunction or decreased libido. And this is it requires a long-term rehabilitation. It takes time to recover after these experiences, and here it's different to estimate the duration of treatment. Another very important context is that we cannot work with such a sensitive topic as erectile dysfunction when military are in active combat zone, because when they come to us and say, I have issues with my erection, and you start to explore this topic, what's the reason behind it. Usually we discover that it's caused by these losses military servicemen experience in a combat zone. So if a person is still in active deployment, it's impossible to process these losses because trauma is ongoing. So in this case, psychotherapy for addressing sexual dysfunction is very dangerous, similar to addressing other mental health conditions. So there are military psychologists who are deployed in immediate vicinity to active combat zone, and they work with various range of issues. While all these topics must be processed when a serviceman is either on rotation or in rehabilitation after integration into civilian life. Unfortunately, we cannot help people in active deployment. We can only harm them. So when my colleagues asked me what to do with sexual health of our military in active deployment, the most importantly is to offer sexual education, because they just message something on social media. I once received a message from military personnel when they saw my Facebook pages. They were subscribed to my page and started to message me. I received multiple messages. In this case, I recommend sexual education. Just explain to a person that you experience a stressful situation, and this situation has a certain impact on you, and because of this impact, you may develop certain issues. So, regardless of a specific situation, regardless of how intense the situation is, we must explain to a person what's going on to them, what's going on to with their sexuality is our top priority task. And the therapy is a totally different process, which is the best to start when a person is outside of the active combat zone, as in the safe area. Now let's talk about how the war affects the sexual health of civilians and military. I think from my speech you already understand that its impacts are quite unique and specific. The war creates quite a hostile environment, so the risks of sexual violence and exploitation population increase, civilians are often exposed to sexual violence because of general instability and helplessness. Military, on the other hand, may also face sexual violence in a service environment or in a captivity. As I mentioned, moreover, combat stress and trauma may also have a negative impact on sexual health, reducing libido and causing issues in intimate relationships as well as other issues. I've looked through some recent research, which is by our American and British colleagues, who studied the impact of combat stress on sexuality, on sexual dysfunction, on PTSD development, and often sexual issues may contribute to PTSD development and result in additional symptoms. It's something very highly individual, but it means that sexuality is truly important for our overall well-being and for our military especially when we talk about sexual rehabilitation. I will briefly touch this topic a little bit later. So according to the statistic here varies. Unfortunately, we cannot estimate the statistics, and let's remember that the war has been lasting in our country for over 10 years, since 2014, Donbass and Lugansk campaigns. And so when we had fighting in 2014, when some territories were occupied, some were deoccupied in 2014, 2015, 2016, we also had different cases in that areas, including sexual harassment by Russian military. So the statistics may be much underestimated. But we don't need to focus too much on statistics, and there's a reason as well. Statistics is okay, is a scientific dimension, but we need to focus on methods and strategies of work, because our key task is to help. Yes, statistics is important, but our key question is to how to support these people, how to provide support and care to them. It's more important, I believe. In Ukraine, it's highly relevant because since according to UN data, the number of sexual violence cases among civilians have significantly increased since the start of the full-scale invasion. Once again, let me get back to the topic of sexual violence. Sexual violence may result in several types of trauma, both physical and mental. Physical injury trauma is about genitalia injuries, sexually transmitted diseases, STD, and often involved pregnancy. There can be other individual injuries, but here we talk about general picture. The most common types of injuries. Psychological trauma covers a much wider range of impacts. It's PTSD, depression, anxiety disorder, sleep disorders, problems in relationships, sexual dysfunction itself. The next thing, like really briefly, because I'm being really brief, I want to follow the timing. So the key sexual dysfunctions, according to ICD and DSM-5, there is a long list of them, but primary sexual dysfunctions in males is erectile dysfunctions, inability to achieve or maintain erection, and it's one of the most common dysfunctions our military guys are facing. Then it's premature ejaculations which happens too fast, and so inability to achieve orgasm because of it, delayed ejaculation, unable to ejaculate during an intercourse. It also affects the intercourse process, low libido, so low sexual drive. Low sexual drive may be also related to various implications of trauma, including sexual violence, acute stress response. Once again, it can be about the fear of deaths or losses, so we can be impacted in many different ways. In females, it's mostly sexual drive disorders, lack of interest to sex, anorgasmia, inability to achieve orgasm, dyspareunia, painful intercourse, and vaginism, vaginal muscle spasm, which makes penetration impossible, so healthy intercourse cannot happen. Why sexual dysfunctions develop? There are different reasons. First of all, it's psychological factors, traumas, psychological traumas, stress. When we talk about excessive high stress, anxiety, depression, relationships, when we have issues in relationship with our partners, it may also provoke sexual dysfunctions. Physical factors that influence development progress of sexual dysfunction include diabetes, cardiovascular disease, hormonal changes such as menopause in women, and hormonal disbalance both in males and females, as well as side effects of some medications. So some medications may influence sexual function, but doctors are supposed to warn you, prescribing these medications are supposed to warn you about it in advance. Most common treatment strategies include psychotherapy or counseling. Unfortunately, its efficiency is limited. So, but still, it's individual or couple therapy. Then pharmacological treatment, if DE5 inhibitors for males, hormonal medications, as well as other general medications. I'm not a medical doctor, so I won't go too deep into this topic. Physiotherapy, exercise to strengthen the pelvic muscles, and educational programs. It's about sexual education, which contributes to better understanding of sexuality. So, impact on military personnel. We may classify these impacts into several categories. First of all, it's traumatic incidents. So, when military constantly stay in active combat zone, they are exposed to serious psychological trauma and may develop PTSD. And PTSD actually heavily affects sexual health, physical injuries. And when we talk about injuries or amputations, a patient will require proper sexual rehabilitation. But unfortunately, we don't have proper sexual rehabilitation programs in Ukraine, because here we need a multidisciplinary team to address both physical and psychological aspects. We often may face pelvic, spinal, and limb extremity injuries, and it's really important to properly interact with our patients during sexual rehabilitations. Yes, we have positive experience when some of our colleagues tried to help such patients, and this support was well received. Right now, Ms. Sviatoslava Fedorenko, psychologist, is actively dealing with sexual rehabilitation. You can research more about her online. Actually, thanks to her and her experience, she learned from International Association of Military Rehabilitologists. They have arranged certain trainings for professionals on sexual rehabilitation. These trainings are very important and valuable to offer efficient support to our military. Psychological stress, various levels of stress, which may result in erectile dysfunction and other sexual issues. The relationships at distance and long-time separation with a partner is another source of issues, especially when man realizes that his partner is very far away, abroad with children, and he's staying in Ukraine or is in active deployment. It may result in relationship issues, and it's sexual violence among military, stigma. Many military are afraid to seek help because of risk, because of fear of losing their career. So, how are we supposed to work with the sexuality of military personnel during the war? Here's a very brief algorithm. Unfortunately, I'm strict time limited, but so I will be very brief. So there are several important steps. First of all, is to build trust and safety in relationships. It's really important to create trust and supportive environment without any pressure. Respect the opinion of your patient, and to be very sensitive. because it's really difficult to build trust if you're civilian and you work with military, so it has certain specific nature. Then it's empathy and understanding. We must always show empathy towards our patient. We must be compassionate about their experiences, and it's really important to work with their feelings, to work with their experiences, emotions, etc. Assessment of a problem, it's when we talk about identifying causes or factors which may affect the sexuality of our military patient. Here we need to take into account potential physical injuries, psychological stress, PTSD, relationship issues, etc. Individual approach, we must always remember about it. Of course, there is some general aspect, but each person is unique. So we must use unique approach, individualized approach, take into account needs, values, and preferences of each specific patients. Psychotherapy normally starts after counseling and assessment. We never start working with sexuality with sex therapy or other psychotherapeutic methods and techniques. So after we have assessed our patients, we identify the most proper psychotherapeutic attitudes to work with sexuality. Our foreign colleagues suggest using various psychotherapeutic strategies, but cognitive behavioral therapy, emotional focus therapy, or trauma focus therapy, EMDR, and some other approaches are considered the most efficient in this field. Then it's partner therapy. So where applicable, we need to pay attention to relationships and communications with a partner, because partner therapy may help to restore intimacy and bring partners closer, especially when we talk about various situations related to relationships issues and sexuality issues within a couple. We also need a certain psychoeducational, psychosexual educational component when we deliver information about potential options to restore sexual well-being. So don't hesitate to share resources and advice which can be helpful to restore sexual psychological well-being. When we work with military clients, we also need to ensure constant support, open communication to monitor progress, adjust our psychotherapy program where applicable, and we also need to remember about good and close cooperation with medical professionals, especially when there is a need to refer a patient to a doctor, medical doctor, because sometimes sexual issues may have physical reasons and we cannot deal with it ourselves. So we need to cooperate with medical professionals. We may need a consultation by a sexopathologist and psychiatrist sometime. If we talk a bit about statistics and of sexual rehabilitation, military people after injury most often faced with the following issues. This statistics was shared by the co-founder of the International Association of Military Rehabilitologists, Psychologists, and Sexologists with the Slav Federates. She mentioned 7,000 Ukrainian military affected by the reproductive system trauma and requiring sexual rehabilitation. Sexual function may be also affected by various injuries such as amputations, spinal trauma, and traumatic brain injuries. So here we see the global picture. The sexual function in military can be affected by various injuries. I mean purely physiological injury. We've already talked a bit about psychological trauma. Let's focus on physiological aspect. Burns, amputations, spinal injuries, traumatic brain injuries, and pelvic bone fractures. Sexual rehabilitation may depend on various factors. First of all, on the nature of injury, on the nature of relationships in the couple, if an injured military guy has a couple or no, and whether couple separated after an injury. So today there is a range of injuries. We witness, we definitely will witness when we did closely interact with our military clients. And for example, federate stress on concussions, on brain injuries, how it affects sexuality, issues it may cause. And once again, PTSD is another very important aspect here. So we must understand that PTSD is mentioned here for a reason, because research shows that PTSD may affect the sexual behavior model. For example, people may deny some pleasures, may take some medications affecting sexual function, and it may result in additional issues with the partner. So if couple used to have conflicts earlier, PTSD may further escalate them, and military are often feel really ashamed to discuss their sexual function with professionals. So here it's a responsibility of specialists to ask about intimacy and to be very sensitive and gentle in asking these questions. And to finish with, where should we refer military personnel with sexual issues? It's a doctor, urologist, who may refer per patient to other medical specialists, and sexologist. I mean a psychologist specializing in sexology. And here, as I mentioned at the very beginning, here we are talking about regular psychoeducation, not about therapy, about counseling. And it's important to explain what's going on, explain that what's happening is okay. And sometimes, because of lack of information, military people may experience terrible things. So it's important to explain it in easy to understand language. Example, military serviceman during combat operation went into a house and saw a body of murdered woman, murdered child, and experiences erection. He is shocked and he's shocked and he feels this depressive and shameful experiences and suffers extreme feeling of guilt. It's also trauma. It's a traumatic event, and sometimes it doesn't mean that this man is a pervert. It's just a psychological response. Some women assaulted by invaders come into therapy and ask a sexologist, tell me please, is it okay that I orgasmed during assault? And it's a normal physiological response, bodily response. This is a response to fear. It's about fear, it's about stress. And we have different situations here, so this topic requires profound exploration, and we can talk a lot about different aspects of it, and it's very difficult to describe this topic within one brief presentation. So thank you so much for your attention, and I hope that this presentation is interesting and helpful for you.